Hey, what's up, guys? It's Dave, and today we're going to go over the COVID-19 EMS response guidelines for Blacksburg Volunteer Rescue Squad and surrounding agencies. Any agency that is in our region that wants to adopt or follow these policies and protocols is also more than welcome to them. They are provided by our operational medical directors and shared throughout our community. They are intended for first responders, specifically EMS personnel. So if that does not apply to you and you're just a general member of the public, well, you're more than welcome to watch this. Just keep in mind that these protocols and recommendations are specific to first responders. And as a non-first responder, there are different recommendations for you. So I do recommend that you seek those out. Contact your local health department. Most of them now have a hotline that they can help you through this stuff. Check the CDC website, and that's really where all of this information is coming from. So if you're not a first responder, I recommend you go there first. Also, keep in mind, this stuff changes often. About every day, sometimes several times a day, information is coming out and getting updated. So if you are watching this video and it is days or weeks or months later, it has probably changed a lot since I'm recording it. So the general idea is still the same. However, I highly recommend that you check for the current information. You can do that by going to the website bit.ly/COVIDEMS, so bit.ly/COVIDEMS, or if you have a smartphone, just hold the camera over that QR code in the top right corner, and that's going to pull up a link to the most current version of this document. So this is updated at least daily, and we monitor it very closely. Our three of our medical directors go through all of the recommendations on a daily basis. We also vet that through the director of the local Virginia Department of Health District, and Dr. Bissell. She has access to these too, and whenever there's questions, our local medical directors are working closely with the Department of Health and the CDC. So check that out, but always, especially as EMS or medical providers, you want to trust what you hear, but also confirm it. So everything in this document is sourced. Go to the very end of the document, and there's links to everything and the dates that they were updated. So don't just blindly take my word for it, especially because I'm not the one that's actually making this. I'm just the chief of our agency, so I'm sharing it with our people, and you just happen to be watching if you don't know me. So make sure that you review this stuff for yourself and make sure that it's current and that you trust it before you implement something at your agency. All right, so with that, jumping right in, when to suspect COVID-19. So this is really going to dictate how we respond to calls and what kind of precautions we use when we are responding to calls right now in these crazy times. All right, so first off, we're going to base it on a few things, and we can base it on any of these factors. So if any of these items here are yes, then we need to suspect that this person may have COVID-19, and we want to use the precautions. All right, so first off with symptoms. If they've had any of these symptoms, so fever, cough, or dyspnea or difficulty breathing, then if they have had any of those symptoms in the last 24 hours, we want to take precautions because they may potentially be infectious or may have COVID-19. All right. Next up is travel. So any travel to high-risk areas, and we will show you a long list of where high-risk travel areas are. But in the last 14 days, if they've been to a high-risk area, then we want to suspect COVID-19 and use the appropriate precautions. I will say right now that is still listed. In the next couple days, at some point in the future, we don't really know when, but at some point, that list is going to include Virginia. And when it does, we're probably going to remove the travel question from this document altogether, because at that point for us, the travel part kind of becomes irrelevant, because if they've traveled to where they currently are, that answer is always going to be yes. So that factor is going to kind of go out at some point. But for right now, we do still want to ask those travel questions. And just in general, that's still a good question to be asking your patients. It's just not necessarily going to always be factored into our COVID-19 assessment in the future, if and when it becomes kind of more widespread and we have community spread in our area, or at least in our state. So right now, travel is still on there. I will show you that list here in a second. See if I can jump down to it real fast and pop back up. So Yeah, here we go. So currently, these I can't even fit it on my screen. It is such a long list right now. That's kind of sad. But so here are our current high risk areas. The ones that just got added in yesterday or today. What is today? Yep, today are in bold. And there's likely going to be some add ons to that tomorrow. So that's just kind of how we're going right now. States keep popping on. Eventually, instead of listing individual states, it's just going to be the US is going to be on that list. And at that point, the travel questions kind of become irrelevant. But right now, those are your high risk areas. All right, the next factor that we're going to look at is close contact. So, if our patient has had close contact with someone who is diagnosed with COVID 19 in the last 14 days, they become a risk factor there, and we're going to suspect that they may have COVID 19 and use precautions. And then the last factor on here is dispatch. So, dispatch, at least locally here, is asking some screening questions very similar to the ones above that we would be asking. And if when we get dispatched, the dispatcher advises us that it is a possible COVID 19 patient or someone who is being quarantined for that because maybe they didn't get tested, but they were suspected of having it. If we're dealing with that and dispatch tells us, we're just going to go ahead and assume that they are at risk, and we're going to use our appropriate protective equipment. So those are the four things: symptoms within the last 24 hours, travel or close contact in the last 14 days, or if dispatch says so. So if any of those are the case, then we're going to move on to the next thing here, which is COVID PPE. So if we do suspect that somebody has COVID 19, what do we do about it? All right, so for one, we want to wear goggles and a simple surgical mask. All right, so goggles or eye protection, really important. That is something that gets skipped a lot of times. Even like watching the news today, I saw some of these drive-through testing sites where they're testing people for COVID 19, and people are wearing masks and gloves and gowns, but not wearing any eye protection. If that person coughs or sneezes or anything, and you're not wearing eye protection, that bumps you up into a higher risk level. So definitely you want to be wearing goggles, something that protects your eyes. Just standard eyewear that you wear if you wear glasses is not really good enough because it doesn't cover all of your eyes, doesn't cover the sides. So like a safety glasses that cover the sides or goggles are the best option if possible. And those are really, I mean, they're reusable. Like you can decon them and use them again. So there's really no excuse to not have those. If you're short on supplies, most of your personnel, employees, or your members probably have a set of goggles or safety glasses at home that they can bring in, and you can decontaminate those by wiping them and letting them air dry. So there's really no reason not to have that. And then at least a simple surgical mask. That does get bumped up a little bit if you're doing certain procedures, but for EMS in general, a general surgical mask is going to be adequate for what we use. And again, these things do change all the time. So by the time you're watching this, the recommendations may be different. Make sure that you look at the source on there to get the most current information. Then we want to be wearing gloves. So definitely wear gloves that we're used to. Most of us are still in pretty good supply of gloves, so that should hopefully not be an issue. And then if possible, you want to also be wearing a gown. If you don't have a gown, that's okay. But what a gown does is it prevents the risk of you having to maybe change your clothes or take a shower if the person winds up coughing or spitting or getting fluids on you. So if you have a gown, wear it. That's the best option. But I know some places are getting a little hard up for gowns. If you don't have a gown or don't have access to that, then just do the best you can. But if you get anything on you, you may have to wind up changing. So just keep that in mind. Also, don't forget to put a mask on the patient. Even if your system is using N95 masks, your patient has not been fit tested. So you know that that's not really going to be an appropriate option for them. Just a standard medical surgical mask on your patient is good. That's really just to prevent any kind of coughing or spitting or sneezing. It's just going to keep in all of those droplets and particles as best it can. So Most places are a little hard up for N95s right now, so we're really wanting to conserve those and even the gowns for aerosolizing procedures. So anything that we're doing that's going to really create aerosolization, nebulizers, bagging, anything like that. A lot of systems are just avoiding those kind of treatments right now altogether. But if you do need to do that for appropriate patient care, you really want to consider that N95 mask. And if your system has enough masks, great, but I think most places are in a little bit of a struggle for that right now. So let's see. So conserve N95 mask and gowns, 7. Yeah, so NEBS, CPAP is another one I didn't mention. So if you have to use CPAP, anything that kind of puts that stuff in the air, then you really want to be bumping up to an N95 if at all possible. All right, so now what? So we used our appropriate PPE and we have turned the patient over to the hospital. And now what? So for personal decon, so cleaning us, remove your PPE. You may have to reuse that stuff. If you've only got a couple masks left, you may not want to throw it out. And, that's going to fall back to your local protocols. For us, what we're doing, goggles, definitely we can reuse those. We just wipe them down with an approved cleaner and let them air dry. Masks, if they are not ripped, torn, deformed, nasty, don't have fluids on them, especially the N95 masks, we can reuse those. The last update I saw from the CDC said 5 times was kind of their recommendation, but that changes. So make sure you check the source there and see what the current recommendations are and do whatever your agency is recommending for that. Make sure you wash your hands. That is super important. I know that sounds really easy and hopefully people are getting better about it, but historically EMS providers have not been that great with washing hands. So we do want to make sure that we're washing hands regularly and often, at least 20 seconds. If you don't have access to soap and water, you can use hand sanitizer, but you want to wash your hands with soap and water as soon as possible and very regularly. And after that, you are good. You're back in service. So really the only thing that's not on there right now is if you were not wearing a gown and you got fluids or something on you, then you may need to remove those clothes or, change, shower, just to kind of fully decon yourself. But if you were wearing a gown, then that's it and you are good. Now, what about my other stuff? So my gear and my truck. All right, the first thing you want to know is when you are deconning your vehicle, you want to be wearing the appropriate protective equipment again. So you may have taken this all off after you dropped off your patient and decon yourself, but at some point we're going to need to go back and get the truck back in service. Somebody's going to need to be wearing appropriate PPE to do that. So they're recommending that you wear gloves and a gown. That is because sometimes moving around in different places, you might get some cross-contamination there as you're cleaning. It doesn't right now recommend because it should be opened up, which we're going to hit here in a second, but it's still not a terrible idea. If you've got a mask, great, you can wear it. But the biggest thing is we have aired everything out. So we're going to go in, wipe all the hard surfaces, all the gear, everything that we've touched, everything that was exposed, but we want to make sure we allow that vehicle to air out. And that is a really important part. So looking down here, as far as when we're cleaning, using goggles and a mask if there's any splash risk. As we're cleaning, use wipes that are approved as a viral pathogen wipe or emerging viral pathogens. So there is a CDC link to that that you can check out and make sure that you have the most current recommendation as far as what you're using to clean. And then for the last thing, where it talks about the truck being back in service after being aired out, the CDC is not currently giving a hard number on that. All right, basically what they're saying is in the time that it takes for you to go in, transfer your patient, decon yourself, do your paperwork, do your transfer, and get all that done, as long as the vehicle has been airing out that whole time, then that should be sufficient. So as the ambulance arrives, when we open up all those doors to get the patient out, instead of what we normally do, which is close them all back up when we go in, we really want to leave all that stuff open. So leaving open as many doors, windows, whatever you can to let that air ventilate out. That's going to take care of all of the soft surfaces and just the ambient air that's in there. And that's just going to leave us the hard surfaces that we're going to have to go back in and decon. So make sure you do that. For our agency, we do want to be safe and not, hopefully not have somebody steal our ambulance while we're doing that. So there is a little security feature where we can remove the key and take that in with us just to prevent any risk of somebody taking the vehicle. So definitely do this with safety and security of your equipment in mind, but you do want to air everything out and let it all ventilate. And once you've done that, so you've wiped down all of the hard surfaces and equipment and you've let it air out, then your vehicle is back in service. For our agency, we do also have a UV light that we use. That is not something that you're going to use as your primary method of deconning. That is something added on extra. So we still need to follow all of these same procedures. We still need to decon and wipe down everything with an approved solution. After all that, when we get back to the station, if you want, you can use that UV light. Generally, we'll run it in like 2 different spots in our truck for like 10 minutes at a time. And that's just going to kind of help kill some of the other stuff that might be in there as well, especially because in general, COVID-19 is not our only concern. So we do want to continue to use our standard precautions in cleaning there. All right, so the last thing on this page is exposure risk, or the last new thing. So how do I know if I may be at risk of having an exposure? So we had a patient, they met these screening criteria, and I used my appropriate PPE. Now what? Does that mean that now after this call I have to go home? Well, generally no. So some of these exposure risks, which we go more into in a later section, if you got fluids on you, so if the person, especially if they were not wearing a mask, they coughed, spit, sneezed, got their fluids onto you, then that could be an exposure risk. If you got coughed on, with that, if they're wearing a mask and they're coughing into their mask, that's okay. But if they're not wearing a mask and they're coughing and that gets on you, then that is a potential risk exposure. If you weren't wearing your mask, so if you didn't wear a mask or you didn't put a mask on the patient, those are all exposure risks. So all of those things could raise that risk level. And anytime you think you may have a potential exposure, you want to make sure that you're reporting that to your supervisor or your infection control officer or whoever you have for your agency that handles that. All right, so that is the majority of what is on this first page. Just to fill you in with some of the other things that we're going to cover from this document. So we just went through the protocols. There is a section where before we come to work or before we start our shift, what we need to make sure to ensure that we're healthy. So that's page 2. Page 3 is a tiered disposition policy. That's really more of a per agency thing, but we'll cover that in a later section. And then 4, which might be really important to you, is an exposure risk guidance. So this is actually something that our either supervisors and our field supervisors or our infection control officer and medical directors use to kind of guide them when they're answering questions or fielding questions that people have about potential exposures. So that'll walk you through that. And then the last page here is a list of resources. So really primarily with that, it ties into this tier disposition policy that we're following. And this is home care guidance that we can give to the patient if we wind up not transporting someone. So we'll talk about that here in a little bit. Some of the recent updates from the 23rd of March. And again, if you are watching this later than the 23rd of March, which most of you probably are, make sure you check back on this document to see the current, because things do change regularly. But on the 23rd, we added some travel risk to almost everywhere. And that's evolving. And like I said earlier, eventually that's probably, that question is just going to go out altogether because everywhere is going to be a travel risk. But for now, that list did grow. Also, some recent updates. We just added that home care guide for our region. So if we wind up not transporting someone based on whatever criteria we have, then this is something that we can provide to them. We added some resources there and added that tier disposition. So check that out and stay with us for the next section. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.